Well, thank you all again, and I am really excited about this opportunity for the talks that are in this room. So Dr. Ruiz, Margain, and Dr. Macias Rodriguez are visiting us today from Mexico, specifically from the Division of Hepatology and Liver Transplant, NGI, at the National Institute of Medical Sciences and Nutrition, Salvador, is it Surban? Mexico City. Both of them are experts in their own right, and Dr. Macias Rodriguez is going to start talking. He has the keen interest to better understand the impact of exercise interventions in patients with liver disease, and such as also its impact on quality of life, muscle mass, cardiopulmonary function, and even nutrition status. So I know he'll be speaking here brief, but we're going to split the 45 minutes with Dr. Ruiz Margain as well, and she focuses on nutritional assessment and dietary interventions in patients with liver disease as well. They both have clinical practice as well as clinical research there as well, and are quite well known for the work that they do in these spaces. So if you'll join me in welcoming them to Indianapolis.
Hi, good morning. Thank you very much for this wonderful presentation. I apologize in advance for my English, but hopefully I can deliver you the right message. So in the next minutes, I will talk about the role of physical exercise in liver diseases. So to start with this presentation, we need to know the concept of what is exercise. So although physical activity and exercise are closely related, they are not the same. Physical activity refers to any movement that you do during your daily life. This includes something like singing, playing piano, and even making friendship bracelets are all those physical activities. So on the other hand, exercise refers to physical activity that is planned, structured, and repetitive. So it has a name. The aim can be improving your glucose levels, sleeping better, achieving a better cardiovascular health. And for this exercise, there are a lot of examples like walking, running, weightlifting, yoga, etc. So what are the general benefits of physical exercise? As you may know, exercise is related to a lot of benefits, including the improvement in bone density, quality of life, cognitive improvement, and also cardiovascular and respiratory fitness improvement, as well as metabolic, and finally, a decrease in cancer risk. All this brings a general improvement in health, and this is pretty much all the benefits of physical exercise. So the next question is, how much exercise do I need? And to answer this question, I would like to show you the results of this paper with more than 400,000 participants with a follow-up of 8 years. And in this study, you can see that exercising only 90 minutes per week, or that's it, 15 minutes a day, was related or was associated to a mortality risk reduction of 14% or 3 more years of lifespan. So in this same paper, the researchers found that for every 15 minutes, there was a decrease in mortality for any cause of 4%, and for cancer, 1%. So as you can see here, only with 15 minutes a day, this amount of exercise will bring you a lot of benefits. So what are the general recommendations of exercise? It's recommended 150 minutes per week, although ideally 300 minutes a week. And with this, we can say we can think if more is better. And to answer this question, I would like to show you this graphic where you can see the health benefits according to the physical activity per week. And as you can see here, between the 150 and 300 minutes per week, there is a clear health benefit. If you see here, beyond this point of 300 minutes per week, there is no additional benefits. So the recommendation in general population is exercising around 150 minutes per week. Although this is only people without liver disease, this can help us as a guide for prescribing exercise in patients with liver disease. So we already know that exercise is good in general population, something about the timing, some of the benefits, etc. But now, what are the benefits of physical exercise in patients living with liver diseases? So the short answer is that they are pretty much the same. As you can see here, in patients living with liver diseases, exercise improves quality of life, also improves nutritional status. It's related also to metabolic and osteomuscular improvement, as well as a cardiovascular and respiratory function improvement in all these variables. All this brings a global improvement, and translating all these benefits into your everyday life, you can see here that, for example, exercise is related to a decreased risk of diabetes, also improvement in the lipid profile. This is really important for people who is taking steroids. Some other benefits include a decrease in osteoporosis risk, an increase in strength, also decreases the fatigue. That is a really important, a really frequent symptom in patients with autoimmune liver diseases. So also también exercise increases or improves your quality of life, improves the sleeping, also very important as a complaint in patients living with liver diseases. And finally, in the cardiovascular and respiratory systems, exercise is associated with a decreased risk of heart attack and also stroke, as well as a decrease in blood pressure. Again, this is really important in people who is taking steroids. Now, the benefits of exercise are all connected. They are interdependent. They are not unique. I mean, if you have better health, you will have more energy. You will be able to perform more leisure activities. And finally, you will interact better with your friends and family. Now, there is no specific data about exercise in patients with autoimmune hepatitis. However, there are some potential benefits in this population. As you can see here, exercise has been associated with a modulation of the immune response and also with a decrease in inflammation. This data comes mainly from people with other autoimmune diseases, such as lupus and also arthritis. In the context also of patients with autoimmune hepatitis, also exercise brings an additional benefit, that is a decrease in fatty liver infiltration. And remember that this is bad for your liver and can increase the risk of liver damage and scarring. So the next question is, what should be the aim of an exercise program in patients living with liver diseases? So the answer is, it depends on the stage of liver disease. The aim for physical exercise is different in people without liver disease than in people living with liver disease. And among these people living with liver disease, the aims are a little bit different among those with early liver disease than those with advanced liver disease. However, there are some common aims, including maintaining you strong and healthy. Exercise also will help you to keeping you active and functional for your daily activities. Exercise is also important for preparing your body for any unexpected event that in the case of early liver disease, can be like something like hepatitis flares and also better tolerance to medications, including steroids. And in patients with advanced liver disease, also this can help, exercise can help you to preparing for better tolerance to medications, some interventions such like surgery or even liver transplantation, or infections also when these patients have some other complication. Now, what type of physical activity or exercise is recommended for patients living with liver diseases? Again, it depends on the stage of liver disease. However, increasing daily activity helps. So if you perform any physical activity, you will improve your general health. So, and with this, I want to introduce you this concept of NEAT. NEAT is non-exercise activity thermogenesis. This is the energy expenditure for exercise not related activity. And as you can see here, the translation of NEAT is your everyday activities. So NEAT refers to all these activities like taking out the trash, also cooking, hanging out with friends, also walking to buy groceries, and any activity at home represents NEAT. So the more you do, the more health benefits you will get. Some years ago, we brought this paper regarding exercise and physical activity for patients with end-stage liver disease. And as you can see here in this graphic, the level of exercise depends on the functional status. So in early phases of the liver disease, you can try some aerobic training, also combined with resistance training. And in more advanced phases, you can also exercise by exercise balance and strength. Remember, always include the nutritional therapy, and all these together will target some of the components that you are looking at in this moment. And finally, all this will bring you to some of the benefits that we already saw in this presentation. So remember that there are different levels of physical activity. My recommendation is be active always. Remember that even small steps can have a really, really big impact in your health. And also remember that you can exercise anywhere. Even if you are in bed, you can exercise. This is something better than doing nothing. Yes. And also, you have different types of exercise for your choosing. You can play tennis, running, do yoga, etc. So a really important message for you is that exercise should be always prescribed together with a good nutrition. This is especially important, or this is even more important in people living with cirrhosis, who requires a nutrition plan tailored to the patient's needs. And the general recommendations are a diet high in protein and sufficient energy in order to decrease the muscle breakdown and also to increase the production of proteins. In this slide are my final recommendations. As you can see here, the first recommendation is to increase your physical activity. Remember to be patient. Start slowly and increase your physical activity. According to some of our studies what we have been doing, walking is an excellent exercise. Remember that every step counts. You can start with as low as increasing your daily activity with 2,000 steps. And after 2 or 5 or 4 weeks, we can increase this to 5,000 steps per day. Remember also that little changes can have a big impact. This means that if you exercise only 10 to 15 minutes, you can achieve your goals. The second recommendation is to tracking your progress and always try to have an aim. And for this purpose, you can use the wearables. Some example of this is the smartwatches. Always try to keep in mind the aim that you want to reach, something like sleeping better, improving your glucose levels, etc. And my final recommendation is always be in touch with a dietitian. Remember that healthy food will bring you additional benefits, and also good nutrition will keep you strong. And remember that if you have any discomfort while exercising or any history of heart condition, ask your doctor before you start a physical exercise program. So my final messages are these. Exercise has multiple benefits for patients living with liver diseases. The final aim of exercise is keeping you strong, healthy, and prepared for any eventuality. Exercise should be always together with a nutritional plan, and ask your doctor for any problem hindering exercise. And remember, start exercising today. Thank you very much for your attention.
Thank you so much, Dr. Macias Rodriguez. Before we move on to the second part of this, if that's okay, maybe just to kick off maybe a few questions over a few minutes. You obviously made a lot of points of seeing endpoints and outcomes of patients with liver disease and how exercise impacts that. How would you counsel a patient in regards to how exercise impacts symptom burden in patients with liver disease, and more specifically, this patient group that struggles with fatigue, joint pain, poor sleep, anxiety, and depression? Is there much that we know about exercise and the impact of those quality of life metrics as well?
This is an excellent question. Thank you very much. Actually, patients with the first symptoms of autoimmune hepatitis, or also with some symptoms of liver disease, have all these complaints. We try to work with them and explain all these benefits of exercise, and also we try to start at low doses of exercise. I mean, something like moving in bed sometimes when they are just lying down, and also sometimes when they are only in the wheelchair. We are really trying to try to them to give some few steps, and this is better than doing nothing. I think that exercise is really tricky at this point, in people with a lot of complaints. But I believe that with the adequate recommendations, with the proper care, and also trying to start really slow with this exercise, is going to help to the patients to progressively increase their physical activity.
Great, thank you. Can I ask the audience, is there any other questions about exercise?
An additional benefit also of exercise is that there is a benefit for depression and also for anxiety. So this brings a lot of benefits.
Yes, Mike, I like the distinction between the physical activity and exercise. And is there a benefit for, like, if your schedule doesn't allow you to do exercise, you know, if you can get an hour and a half or 2 hours for a period of time, is that better, or does it count towards 150, or is it better to have it spread across the week, let's say?
I think that we don't have a specific amount of exercise for you. for you. There is no any guidelines regarding liver diseases. So what we do with our patient is starting something like 10 to 15 minutes of walking and trying to increase the daily steps above the daily activity around 2,000 steps. And this really helps the patients. This is combined with some resistant exercises and also some movement trying to lubricate the joints. And this is always, we need to always be together with a nutritionist. Yes, also if we can split if you split this, the amount of exercise around the week, you can get all the benefits. It's not only that you need to exercise continuously.
In your talk, you mentioned, you showed a slide where it showed steps and then resistance training and then balance and strength. For somebody who has limited time, let's say, would you prioritize aerobic activity over resistance training, or would you prioritize resistance training over aerobic?
This is an excellent question. Thank you very much. I think that maybe the answer is depending on what do you want to achieve with this patient, what is your aim. And also it depends on what your patient can do. I mean, some patients are not able to walk. They don't have enough time to walk, so maybe while they are sitting in their office, they can use something like these bands, and you can prioritize this type of exercises. You can go also walking every day, trying to use less in the car, and also try to walk every day more, and also use more the stairs and everything, and something like this.
I like what you're saying because it sounds like you work out a plan with your patients, right? I mean, you will be medicated, but in addition to being medicated, here's some other things we will do. And I think going back to the unmet needs, to me it seems like this is something that every patient would love to have. You know, here is your plan. You can work with this nutritionist or this dietitian, or however, you know, and I'd like to see you get this amount of exercise in, and then follow up on that plan with visits. I mean, how much more holistic would that be? It sounds like that's not a need that gets met for everybody. So I guess that's my point. It's really encouraging that you're doing that.
Yeah. Yeah, I mean, we try always to be together with a nutritionist and give to you as a patient all these recommendations. We know that it's really tough because we don't have enough time, but we are trying always to work with exercise and a nutritional plan for every one of our patients in our liver unit, so we can have better benefits instead of only those related to medication. That is something that, I mean, the medications are good. They are the standard of care for our patients, but we need to do something else. And this something else is exercise and a very good nutrition plan.
Great, thank you. So we'll have Dr. Ruiz Margain also then follow up with another important talk over the next 20, 25 minutes, and it's diet nutrition for the liver patient.
Hi, so I will follow up on the diet part. First, I want to thank Greg for the invitation and Dr. Chalasani. We're really happy to be here in Indianapolis. It's our first time. So basically, yeah, I work in the liver unit in the transplant nutrition setting. And we work together very closely with the gastroenterologist and the hepatologist. And I have my specialized nutrition clinic for all liver disease patients. So this is what I'm seeing every day I've been doing this for 13 years. So basically, I just want to remind you the importance of the liver. And the liver is a really important organ, and it does a lot of functions. But some are very related to nutrition specifically. So we try to always keep this in mind, because this is where we're based our treatment. It's based on the functions of the liver. So basically, the liver helps you to digest and absorb nutrients, and it also stores the nutrients, and then it uses them to produce energy. So when there's some sort of liver damage, this can be kind of impaired. So then you can really think that you need more nutrients. So it depends on the stage. It is also involved with metabolism and detoxification, but it also produces proteins and helps you store proteins and help you to absorb, especially fat-soluble vitamins. So this is something that we will touch on later on. So as Dr. Macias was mentioning, the importance of nutritional status is really big in terms of liver disease. It's basically related to better quality of life and less complications in general. So we basically focus on two types of things: body composition and physical function. So in terms of body composition, what we're looking for is that you have enough muscle mass, that you have good bone mass as well, and that you have just the right amount of fat mass as well, because fat is very useful, but when it's a little bit above what it's expected, then it can get you into trouble. And then physical function is really important for liver diseases in general, but for autoimmune hepatitis, it's also really important because of the fatigue that you were all mentioning. So basically what we do is we treat these alterations with diet and exercise always. So I wanted to just talk about a day in my clinic. So what would a patient have as an evaluation in my clinic? So I'm very lucky because I built this clinic around my needs and my patients' needs. So I always have, per each new patient, I have a 1 hour consultation. And normally follow-up visits are monthly, sometimes weekly if patient needs this. If the patient doesn't need this, then he can come or they can come every 2 months. It really depends. But normally the follow-up visits are also 1 hour long if needed. So we don't see as many patients per day, but we try to give a lot of good quality assessment. So basically what I would normally do in a day is that patient comes and I will just get general information on the stage of liver disease, if there is fibrosis or not, if there are other diseases, if there is hypertension or other autoimmune diseases, just general things about the patients, and what medications they are on. So of course, if there are steroids that you were mentioning, it's really hard for weight loss, but we will target this. All the patients get body composition and functional tests, so we will know exactly the amount of muscle, of fat, of fluids, of strength that the patient has, and also the functional capacity. And we also talk to the patients to see what they are already eating, so if they already have a plan or not. We assess which type of dietary pattern they are having, what type of foods they are eating, what they like, how many meals per day, who's cooking, where are you getting this food from, if you're buying it, if you go to restaurants, if you're cooking at home, and also appetite. So this is really important for us, so we get the whole picture, and so we can give some recommendations based on what you're already doing, and so we're trying to implement this treatment. So all of our patients go with a personalized diet and exercise plan. This is what we based on. This is probably not so easy to calculate for you, but this is what we use to calculate. This is based on just general liver disease recommendation for patients, so for liver disease, not always specifically with AIH. But, so the idea is that we will give the calories we base. If we see overweight or obesity or just increased weight in general, we will maybe target a caloric restriction. If not, we will just leave the calories to maintain the body weight. And if we see some sort of malnutrition, then we will increase the calories. One thing, I will be talking about each of these topics later on, but just in general, protein is really important. So we give a high protein diet. We try to give with both types of protein. Then the amount of fat, so fat is, probably sounds bad, but it's a good thing. And we try to give mainly the good fats, so mono and polyunsaturated fatty acids. And then for carbohydrates and fiber, we don't use like these. Carbohydrates can be like these simple sugars that can be found, but there's also really good carbs that you can implement. And then we try to give high fiber diets. Always exercise, so if we see the patient can perform just general aerobic training, then we implement this. If not, we send them to physiotherapy, and then we also have a really good team of physiotherapists that are willing to train the patients as well. And we consider supplementation in some of the patients depending on what we're seeing. So I will talk about the good things or the things that have shown some of the benefits, and later on just the bad things that we try to avoid just in autoimmune hepatitis. So in terms of protein, as I was mentioning, basically what we are looking for is to prevent sarcopenia. So sarcopenia is the loss of muscle mass and muscle strength, and this is something that will happen normally with aging, but also with any chronic disease that you have, you're more prone to have sarcopenia. And even if you have obesity, then you can also have sarcopenia. So muscle is a really important organ. So sarcopenia is associated with fatigue, also with the risk of falls and fractures because it kind of like protects your bones. It is also related to metabolic complications. So when you don't have enough muscle, you can develop insulin resistance or high blood pressure. And also it can increase your hospital stay or some complications. So basically what we try to implement is both types of protein, so animal protein and plant-based protein. So unless the patient tells me, you know, I'm a vegetarian, I'm vegan, then I will do some other strategies, but just in general, in Mexico, we're more prone to both types of protein. So animal protein is really good because it contains all the amino acids, so it's the best quality of the more easily absorbable protein. And plant-based proteins is also really good, but it doesn't have all the amino acids, so we have to combine different types of proteins, and sometimes we need to supplement. But it comes with a lot of vitamins and minerals, so this is good. So this image, I love it. This basically shows how much food you need to consume to actually get 20 grams of protein. So you can see if you get, I don't know if you can see my pointing, but if normally with animal proteins, with less than one serving, you can get around 20 grams of protein. And if you're looking to go vegetarian or vegan, then you will need a lot of portions of these types of food. So what we try to do is mix. And if you don't like animal protein, what we do is just supplement also modules of powder protein or protein shakes. Now, fiber is another thing that is really important. So this is actually, I started my research career doing high fiber, high protein research trial in autoimmune hepatitis. So basically what we were trying to do is just increase protein and fiber intake. And just in general, when you add more fiber to your diet, you will be less hungry just in general, but you will get very good types of nutrients. So fiber is found in most fresh foods, so fruits, vegetables, nuts, whole grains, legumes. So basically just try to choose these types of bread instead of just the white bread, and just try to eat a lot of fruits and vegetables within the meals. And the good thing about fiber is that it can help with the itching. So because it can help with the absorption of some of these compounds that can cause the itching on the skin. But it's really good for the gut microbiota. So microbiome, I think there will be a talk later on. But basically, it's all the microorganisms that you have in the intestine. And fiber is a really good way to make sure that the microbes that you have, or the microorganisms, are the good ones. So there are good and bad. But if you're using fiber or consuming a lot of fiber, then you're feeding the good microorganisms, so you will get better gut health, and this is related to just less inflammation in general. So we suggest a lot of high fiber diets. Mainly, it's normally above 30 grams per day. Calcium and vitamin D are, of course, very important. Normally, we try to, it depends, so we check the levels of calcium, and also doing just bone density measurements, not myself, but just in general. And we check for osteopenia or osteoporosis, which are kind of frequent and in autoimmune liver disease. So basically what we try to do is just give a good amount of these nutrients, and if it's not possible to eat, or you don't like, or there's a big decline on the serum levels, then we will also do some supplementation. But these are good sources that you can see here. Mainly is dairy, and some seeds, and also, vitamin D also in salmon, eggs, and some mushrooms. And of course, you have to come to sunny Mexico to get more vitamin D. You're all welcome. Now, as Brooke was saying, coffee is good for your liver. There's a lot of studies coming recently, and also some mainly epidemiological studies. So it's not like they chose patients that gave them coffee. They just check on the data, big data from the US and from different countries, and they just checked if coffee was associated with different complications, etc. So basically, what it has been found is that coffee reduces the risk of developing liver fibrosis when you have mainly fatty liver disease. It lowers your liver enzymes and also causes less insulin resistance. Then there was also an interesting study by Dr. Lambert that coffee consumption in general is associated with less development of, or risk development of, autoimmune hepatitis. And also it has been shown to be associated with less progression to cirrhosis and liver cancer. So coffee is really good. Of course, as Brooke said, is black coffee. So this is not coffee. I consider this a dessert. So some patients come, yeah, I have my Starbucks every day. I don't call that coffee. So just black coffee, you can add sugar or some sweetener if you want, but just this type. And what has been seen is that it's dose dependent. So the more coffee you have, the better, or the bigger impact, especially on liver fibrosis. And this is mainly because it's a good antioxidant and anti-inflammatory beverage. Also, it depends. So if you like coffee, this is very good for you. If not, then you can try to get antioxidants from other foods. And also, if you have like some heartburn or something that if it gives you any gastrointestinal symptoms, you can stop it. But just in general, it's something that all my patients get recommended. Then omega-3, this is a really good nutrient. This is a type, so these are basically fatty acids, so these are the best types of fat. I will touch on Mediterranean diet later on also. So basically, in olive oil, in avocado, and some seeds, you can find these fatty acids. These are basically, you may have seen this as DHA or EPA. So these are very fish oil supplements that you can also find in stores over the counter. So these are also found there, but it's also good that you try to use more of these foods. And I brought this from fatty liver disease as well. There's a lot of studies that have shown that it's good for inflammation in patients with fatty liver, so it can help to decrease the amount of fat and decrease liver enzymes. Now, not all studies are showing this, but there's some studies that are. So basically, when I have patients, because omega-3 has also been shown to be associated with better neurocognitive health and also just cardiovascular health and a lot of health benefits. So when I have a patient that is very fatigued, and I know it's common, but just more fatigued than normal, maybe some brain fog, and just a lot of inflammation in the liver, I normally try to increase foods with omega-3, or I could just start supplementation. Mainly is 1 or 2 grams per day, so I normally start with 1, because it can cause some bad taste, and so I normally start low and then increase. So basically, all of that I have been saying is part of 2 dietary patterns, mainly the Mediterranean diet that you also mentioned before, and the DASH diet. DASH diet is not so known, I don't know why, but it's also really good. It's basically for hypertension, but it's just a really good dietary pattern. So both of these diets include vegetables, fruits, legumes, nuts. So basically a very fresh foods, low-fat dairy products, and not so often. Rare intake of red meats because they cause inflammation, and also are associated with risk of cancer, and rare intake of sweets. And the interesting part, or the landmark part of the Mediterranean diet, is the extra virgin olive oil and the high consumption of fish, mainly salmon. And in terms of the DASH diet, it has reduced sodium. So normally it's for hypertension, but it's just an overall good diet. So normally I don't give, like, the patient comes to me and I don't say, you will get this diet and it's going to be very strict. So what I try to do is just implement these changes and try to get this pattern as much as possible, this type of diet as possible. Now, the bad. So basically, what we try to do as well, and it's also associated with the previous slide, is ultra-processed foods. So ultra-processed foods are basically, so this is the classification. So minimally processed foods are just what you find in nature normally. Processed foods are what what is used to sell them or to store them. So canned foods or preserved foods somehow, these are processed. These are good. You have to process them somehow, so these are good. But then ultra-processed foods are basically foods that you change their actual composition to improve the texture or change it, or the taste, or to just expand the shelf life. So you will add a lot of emulsifiers and sweeteners, and basically these foods don't have a lot of nutrients, so they just have a lot of chemicals in it. So basically, this is an example. So you get the corn, and then you get the canned corn, and then you get corn chips. So ideally, you will stay in the processed section, or if you can, in the minimally processed. Of course, this is a recommendation. It's not like if you eat processed food, something extremely bad will happen. You just have to lower the intake of this, because there's a lot of studies coming also that they are associated with some types of diseases. So it has been shown that it is the high consumption of ultra-processed foods is associated with autoimmune diseases in general. Especially, there have been 3 studies that show higher incidence of Crohn's disease and also other thyroid diseases. Also very associated with cardiovascular disease and cancer and metabolic syndrome, Alzheimer's. So just try to limit as much as possible. And there are some worrisome data that in Mexico and in the US, as much as 30 to 60% of the diet can come from ultra-processed foods, so just try to decrease this as much as possible. And I found this diagram that I found really interesting. This is basically ultra-processed foods that are very high in sugar, very high in the bad types of fat, and very low in fiber. So this bad nutritional quality is completely associated with, I'm sorry, how do I go back? Previous. It's associated with fatigue. So just high sugar, high fat diets are associated with fatigue. So if you have fatigue, just try to reduce these types of food as much as possible. Then also it is associated with poor microbiome and with leaky gut. So basically your intestine becomes thinner and it can pass some bacteria, and it can just, this bacteria can cause more inflammation. So this is also associated with this. Then the additives and the emulsifiers and everything are basically chemicals. So these have been shown to trigger the immune response. So this is, we don't know actually the effect of these colorants and emulsifiers that they have in health, but they are showing that basically the immune system would be activated. So maybe it can help to decrease a little bit the immune response if you stop consuming or decrease the consumption. And then sweeteners. This is a debate still going on whether you can or you should include sweeteners, artificial sweeteners in your diet. So basically they are saying, some studies are saying that they are also increased with higher risk of cancer, and other complications. What has been really proven is that it is associated with insulin resistance. So normally I try to avoid this as much as possible. I participated in a consensus in Mexico, and I review all the evidence in liver disease. So basically the stevia sweetener is the best that we've found for the liver, and the rest, so Splenda and all of these are associated with insulin resistance. So stevia basically is what has been shown that it's good for patients with liver disease, but we still need more studies. So basically my take-home messages is just to try to include a high-protein diet, try to include fresh foods, and cook at home if possible. You can use or try to include also salmon or olive oil, which is really good for omega-3, or you can also ask your doctor or your dietitian for supplementation. Decrease the ultra-processed foods as much as possible, and just to try to plan ahead your week maybe, because this sounds like really good, but maybe it's hard to take it into practice. So just try to plan ahead and just buy for the week, and you can maybe cook for a week and then you can store it and try to use it so it's easier, or you can bring something to your work, prepare from home so you don't have to buy outside. And basically just want to say thank you. This is the history of our hospital. It's the 77th anniversary of our hospital. It started as this small thing in the middle of Mexico City, and now it's grown considerably. It's a National Institute of Nutrition, and this is part of our team, so thank you very much.
So just for the consideration of time, we maybe just take a few questions. First, a comment by Dr. Chalasani, if you don't mind.
Really great talks, Astrid and Ricardo. I think you brought up about holistic care. So I was visiting their hospital about maybe 6 months ago. I was, here in the US and elsewhere, I probably have seen 50 different universities. Nothing like what I have seen there. They were so holistic. I was just incredibly impressed, and I called Dr. Lammert from Mexico City, and I said, we need to have him over here. And then their diabetes clinics, as well as their fatty liver disease clinics and others, have at the same time when the patients come, the providers are all in one location. They go from room to room to room rather than going from one building to another building. Really incredibly impressive and really great work you both do. And their chief is here, Dr. Naeli, and really a great job that you're doing. I want to congratulate you.
Thank you.
We're going to start in the back corner of the room.
Thank you. That was very informal and informational. You mentioned about protein and omega supplements. How do you feel about fiber supplements as well?
We use them, so we try to, because when you consume foods with high fiber, then you also get extra benefits because it's fruits and vegetables, and it comes with a lot of vitamins and minerals. But if you're not reaching the aim, we definitely use them, and there's a lot that you can find here over the counter. So if it helps to increase the intake, we definitely use them, and it has been shown that sometimes it's more concentrated or with just a specific type of fiber that it's good, and it's associated with the improvement of gut microbiome.
Hi.
Sorry.
Thank you. Lovely presentation to both of you. I'm curious. I'm being treated by functional specialists, and I'm glad that you mentioned both the vegans and non-vegans. I'm curious if you've had the opportunity to look at the comparison between those who are vegan or vegetarian or mostly vegan and non, to see if there is a decrease in some of the symptoms, because I noticed since I've switched to vegan, I don't have the foggy brain anymore, I don't have the fatigue, and there's a lot of anecdotal studies, and I'm curious if you have any empirical evidence to support that.
Okay, this is a really tough question, but so one thing is that in Mexico, we eat a lot of animal protein. But there are a lot of, also now, I think vegan community is growing. My sister is vegan, so I try to keep her well-nourished. So yes, I have seen this. So what we normally try to do when a patient comes that actually eats animal protein, we actually decrease a lot of the animal protein that comes like red meat or even poultry. So we try to switch it to fish and dairy, because it sounds like it might be anti-inflammatory, but dairy has come from many studies that it's really good for microbiome and just in general. So we try to switch to dairy protein and some chicken and some fish mainly. So even with that, I see a lot of improvement. When they decrease red meat in general, they improve a lot of the symptoms, because red meat in excess has been associated with fatigue, even in patients without autoimmune diseases in general or autoimmune hepatitis, so yes. And in vegetarian or vegan patients, it's tricky because sometimes they can have sarcopenia or some vitamin deficiencies because they are not eating all of the nutrients that come from a lot of these types of foods from animal sources. So they can have some anemia, or they can have decrease in some B vitamins or some zinc or magnesium. So if they don't have this, they definitely, just because this pattern with a lot of vegetables and nuts and whole grains is really good to increase energy. So definitely I think plant-based diets are good if they are checked and supplemented, and just check that you are not having a decrease in protein in general or nutrients, and it's really good. So what I normally try to do is try to decrease animal protein, so I give 50-50 normally, and increase a lot of the plant-based, and because it comes with a lot of nutrients, then it's really good. I feel Craig coming. So yeah, it definitely, you should try it. Okay, I can take 2 more questions.
Nice to talk, Dr. Margain. You mentioned earlier that the stage of liver disease and the diet. My question is for the patient whose liver is decompensated versus the patient whose liver is still compensated. Any difference you would recommend to the patient about the diet plan?
Yeah. So basically, it's very similar in terms of the components, because these types of foods are generally good. But patients with decompensated liver disease need much more energy and much more protein, but a lot more. So we try to increase this consumption, and sometimes we give protein shake supplementation, but basically we just increase the amount of nutrients that they would need, but the general recommendations are the same.
Maybe one more.
I have 2 quick questions. The first one is, I seem to be very sensitive to caffeine, so I'm wondering, is decaf coffee does it still have the benefits? And then I have seen a primary care physician who has like leans into autoimmune diseases, and she has sort of followed what she says is the autoimmune protocol, which is to avoid gluten and dairy.
Yeah.
So I'd be curious to hear your thoughts on the gluten and dairy omission.
So decaf is as good as caffeinated coffee. There's a lot of studies for the effect on liver fibrosis. They checked like different types of coffee, decaf and just powder, and from whole grains, and also from the capsules for Nespresso and stuff. So basically, the effect is better when there's when it comes to the grain coffee. But just in general, the effect maintains even if it's decaf or it's powder coffee or soluble coffee. So yes, you can, it's really good if you, I actually also use a lot of decaf myself. And gluten-free and dairy-free, this is also happening a lot. So there's a lot of controversy. I don't have the conclusive answer because there's some studies that are showing that it's good and bad. So specifically for gluten, I do not recommend to limit it from the diet if you don't have celiac disease. So I work in the gastroenterology department, and I have a lot of patients with celiac disease as well. So they suffer a lot with these very restrictive gluten-free diets. So if you don't need to, I don't recommend it, and there's no data that shows that it's, so basically for gluten, it's not so much the association that it can increase autoimmune flares or something. There's no data, but there's a lot of just general data in social media that gluten is bad. This is happening also in Mexico. So I wouldn't fear gluten. In terms of dairy, it's also, I mean, it's also debatable. There's not, some dairy, because it's a lot of high fat content, can be inflammatory. So some studies initially showed that dairy was bad, but it was probably because of the high fat content, not because of the other nutrients. So what I suggest, if you like dairy, is low fat, or just, I do not suggest a lot of these almond milks or stuff like this, because they don't have good protein and they're very sugary and they're basically ultra processed. But I do suggest maybe soy milk if you don't like cow milk. So it really depends on the patient if they are not, if they don't like this type of food, but there's no conclusive evidence. But yeah, we will see in the next years, I guess.
Great, thank you guys so
Thank
much.
you.